and welcome to my podcast, The Chemistry of Life, where we explore the intricate world of health, wellness, and how it relates to chemistry. I'm your host Rudraansh, and today we are with Dr. Gaurav Bhalla, a physician who works at Max Clinic. So now let's talk more about diabetes medication.
So we have different class of drugs. There are many drugs available. That is metformin, which is a common biogonide, which is the most simple drug available in the market in India.
Okay.
So it is the basic drug, which is the first line regimen used for the treatment of type 2 diabetes. Obviously, for type 1, it is only insulin, only and only insulin. No oral drugs are available as of now for type 1 diabetes.
Okay.
For type 2, again we have the first I told you metformin. Then we have another class of drugs, that is sulfonylureas, which includes glimepiride, gliclazide, glyburide. Again, there is DPP-4 inhibitors, which includes the latest drug in the market, which is sitagliptin, vildagliptin, linagliptin. And again, there is the SGLT2 inhibitors. We have empagliflozin, dapagliflozin, and also we have canagliflozin. The latest drug in the market, which has been recently launched by Novo Nordisk by the name of Rybelsus, it is oral semaglutide.
Okay.
So it is basically incretin. It increases, it decreases the glucose levels. Also, it helps in weight reduction by increasing the satiety. So it disturbs the hunger center of the body, increases the satiety. So the patient eventually loses weight, and eventually his glucose levels come down.
Okay, so that's what this drug does in the body.
Yeah, this
Can
is
you tell
oral
what the
glum.
other drugs do in your body?
Yeah, so metformin, again, it is the most basic drug which is used in the treatment of type 2 diabetes.
Okay.
Again, the metformin, what it does is, it is basically used for insulin resistance. So the main purpose of metformin is it increases the insulin sensitivity. Again, it helps the body to, the peripheral pushing of the glucose into the peripheral tissue, that is in the muscles. So
Okay.
metformin does that job. Also, it pushes the glucose into the liver, thereby leading to gluconeogenesis and eventually the glucose utilization, which has to be done by the liver and peripheral tissue. Metformin helps the body to in doing that.
So it basically acts as insulin.
Yeah, insulin sensitizer, you can say that it is an insulin sensitizer, and decreases the insulin resistance in the body.
I see.
Yeah.
And are there any negative side effects of this?
Yeah, see, metformin, the most common side effect is, nausea, vomiting, bloating. Patients experience bloating in the body, in the stomach basically. There are chances of diarrhea as well with the metformin. So
Okay.
these are the most common side effects which we normally see in a patient who is on metformin.
What exactly causes bloating in your body?
What exactly causes? See, metformin as a, because this is a medication, any medication in the body, eventually can cause nausea, vomiting, and diarrhea. So it depends upon person to person whether he's having any hypersensitivity reaction to that drug or not.
see.
So, and eventually the normal dose, which is the maximum dose recommended for use of metformin, is 2 to 2.5 gram per day. If we exceed the dose, many people, experience these side effects such as bloating, diarrhea, pain in abdomen, increased, burping. That is also one of the main side effects of metformin.
So I was just curious to know whether bloating, is it more related to water retention or more related to like a gastrointestinal issue?
It's more of a gastrointestinal issue. Metformin does not interfere with any water retention or water loss from the body. It is more because of gastrointestinal irritation of the body.
Okay. So you had spoken about diabetes medication being used for weight loss.
Yes.
So I've also heard that a lot of celebrities in Hollywood use it to like lose weight.
Yeah.
So what are the potential side effects this can have?
See, the most common drug these days, which is being used by the celebrities, is tirzepatide. So it is not available in India as of now. It is more available in US, and US FDA has given approval for weight loss in Western countries, not in India.
I see.
In India, it has not been launched yet. It has it's still been awaited, and if at all we get an approval, I think we will get it for obese patients who are having diabetes. So we cannot recommend it to general population for weight reduction. So first of all, we need to understand that, because many people in India wants to reduce their weight, but they are non-diabetic. So the doctor cannot prescribe them on paper for those medications. For patients who are having diabetes and they want to go for weight loss, yes, we have drugs in India. That is, I already told you that we have oral semaglutide. We also have injectable medicines. Again, injectable semaglutides are available in India also. So we can, give those drugs, but they are only approved for people who are having diabetes and as well as they are obese.
So you would suggest that somebody who does not have diabetes would just go the regular way and
Yeah, the first thing he should concentrate is on diet and exercise.
okay.
Otherwise, we have other medications for weight reduction, but those are medications, which are not related to diabetes, but they are definitely only for people who are obese, and we can prescribe those medications. But those medications also have some side effects. So we preferably, the first line which we recommend to patients is diet and exercise. That is the most common prescription which we advise to the patient.
I see. And do you think to go with this method of taking injections for weight loss is better than, let's say, liposuction, which are both like artificial ways of losing weight?
See, again, this is again, every therapy has pros and cons.
Yeah.
Again, if we go for liposuction, we can remove fat, but eventually we have seen patients who have again, gained weight and gained fat in their body even after liposuction also.
I see.
Same goes with these medicines also. We have seen patients who, eventually they have again gained weight after stopping the medicine. Also, their appetite has doubled after stopping the medication.
Okay.
So we have seen all those kinds of patients, who have rebound weight gain because after stopping these medicines.
I see.
So preferably, again, I would say these medications, they are very good when used in certain amount and for certain duration. Once you use them, for a long duration, then they're bound to give you some side effects.
I see. So you said that people gain more appetite. So it's almost as if the body is trying to recover.
Yeah, it's a
the
rebound
fat
weight
and-
gain. We have seen such patients, not every patient,
Yeah.
but we have seen such patients who have been, complaining of rebound weight gain after stopping these medications.
Okay. So the body wants to get back to its previous state.
Yes, yes.
Okay.